I was cut off, but I have, I could add just one more point if I could.
Sorry, so where are we at time then?
45 seconds.
Yeah.
Yeah. Okay, he'll warn you when you got 15 seconds.
Oh,
I'll
I
cut
see.
you
I'm
off
sorry.
when you're done.
Okay.
I'm sorry.
That's
Carry
okay.
on.
Well, I mean, we've been working directly with First Nations. This Kelowna Accord, for example. I mean, the federal government has put more money already into important infrastructure on reserves, housing, water, sewer, to help First Nations grow and develop, and the same could be done for economic development on the reserve.
Thank you. For our second question, we'll start with Brian Fillmore. What do you say to the unemployed forestry worker who blames government policy that allows raw log exports for a crumbling island economy?
Well, I was speaking to Pat Raw a couple of weeks ago, and I was informed recently that in the last 18 months, 24 new sawmills have reopened in British Columbia. Our lumber exports have increased tenfold in the last 10 years, from 400 million cubic board feet to 4 billion cubic board feet. So the policy in place right now, 10% of our logs are being exported, 90% are being milled into lumber and other products before they're exported. I can't condone just shutting down all raw log exports right now and putting a bunch of other people out of work in a time when we can't afford to be putting people out of work. But the goal is, well, right now we're only 10% of our logs are being shipped out as raw logs. So we're going to continue working on that and improving that, but I couldn't condone just shutting it down completely and putting people out of work right now.
Thank you. Gene Crowder.
NDP has always been clear, ban raw log exports. It has a direct impact on the availability of fiber for our small and medium-sized remanufacturing facilities. It impacts on the tax base locally. We are proposing not only banning raw log exports, but putting in a value-added tax credit for processing locally. I think it's an important part of growing our local communities. We saw some sawmills and ladysmiths shut down for a couple of weeks, partly because of conditions in the woods, but there was also a lack of fiber supply. And when I talked to some of the workers at the plant gate the other day, they were talking about the fact that it wasn't preventing significant numbers of trucks leaving our island going elsewhere. So it's very difficult for our workers to continue to watch logs leave the island and watch their jobs go. So value-added tax, ban raw log exports, and work with the provincial governments around the Crown land piece of it, because the federal government only has a role on the private lands.
If we ban raw log exports today, do we still have the facilities on the island to process all those logs?
Well, some of those mills are not working full shifts. And so they do have additional capacity, and some of the mills are still shut down. So we do have the capacity. What you actually have to do is make it more attractive, more financially viable for them to process closer to home. I didn't also add that what we need to do is provide loans and loan guarantees and incentives for retooling the mills as well, so that they can be competitive on the world market.
Right. John Corey.
Well, much of what the NDP talks about is already happening, except for this completely irresponsible idea to ban logging on the island. I mean, could you imagine? I mean, I talked to longshoremen, truckers, fallers, and they're saying to me, if you ban raw log exports, you wipe out what's left of this industry, and that is just a non-starter for our economy. What the Conservative government has done is it's opened new markets and less reliant on the American markets, and opening new Asian markets for our milled lumber. And those mills are getting busier. We're turning a corner on this industry. We're providing incentives. Hundreds of millions, tens of millions of dollars have been invested in Harmac Pacific and the catalyst operations to help them be more efficient, more productive. That's what the Conservative government has been doing, and we will continue to make those targeted investments to allow the forest industry across the board flourish.
One quick follow-up question. You said that we're turning the corner. Seems to me that we've been hearing this for a while. When will we get around?
Well, I mean, look, the country has just come out of the biggest recession it's had since the 1930s, and it's largely due to the fiscal management and the steady hand on the economy from the Prime Minister and the Conservative government. And we're finding new markets for that milled lumber. In China, for example, it's growing tremendously for milled lumber. I go down to the mills. The milled lumber is stacked up, waiting for it to be shipped to those places, and that is the corner that's being turned here. We're finding those new markets, and the mills are busier now, and we will continue along that process.
Thank you. Anne-Marie Benoit, please.
Well, when it comes to the logging industry, as I've been hearing for the last 20 years, shutting down slowly, and now they're not Canadian anymore owning these mills. They're either American or German or people from other country. And I stopped in Chimay-Nez, and I don't know where the men's are. They all left town. They lost their house, and I think we start to just forget what happened the last 20 years. How much work people lost, how much homes, how much destruction it caused. And I think we have to create employment here, and the Green Party has a platform, and we can bring back job over here if we think properly of processing our log over here by Canadian owners instead of foreigner. That's my view on this, and the Green Party has a strong platform.
So, raw log exports, yes or no?
No, we don't want it.
Thank
if
you.
we do, we want to tax it.
Thank you. Our third question, we will start with Jean Crowder. What is the federal government's role to ensure aging and crowded hospitals, like NRGH, remain viable for an increasing population?
So the federal government doesn't have a direct role in the delivery of health care, but where the federal government does have a role is in a number of different areas. First of all, the health accord expires on 2014, so there needs to be a dedicated transfers to the provincial government, and it needs to be a dedicated transfer that goes directly into health care with an escalator clause of 6%. That's one thing that they can do. The second thing that the federal government, that NDP is proposing that they do, is that we include long-term care under the Canada Health Act, which will relieve the overcrowding in our acute care hospitals. We know that in many cases we've got some of our seniors are taking up acute care beds because there isn't the long-term care facilities available for them. The third thing that the federal government could do is put a dedicated transfer in place on home support care. We know that many seniors need some additional help in staying in their homes. They don't need to be in the acute care system, but there isn't this home support available for them in order to stay in their homes. So the federal government with a dedicated transfer to the provinces, because the provinces will deliver that, so we have to work closely with them. The other thing that you can do in terms of overcrowding is that we're proposing a home renovation tax credit that will allow people like many of us here to renovate our homes in order to keep our parents at home with us. Sometimes that means wheelchair ramps, sometimes that's additional facilities in the washrooms. So those home renovation tax credits can also keep people out of the acute care system. As well, in terms of cost, although this doesn't directly affect the hospital itself in terms of overcrowding, a national pharmacare program will be important in terms of reducing cost in the healthcare system, which will allow them to make decisions about where else they're going to put money. So I think there's a variety of things that we can do in terms of overcrowding in the hospitals that are provincially responsible for delivery.
Thank you. John Corey, 1 minute, please.
Yes. Well, the first thing that the Conservative government did is restored the funding to the provinces that the Liberals had slashed in their deficit fighting days. So they've been restored with an agreement with the provinces and have been increased 6% every year. Before this election, we were already working with the provinces to extend the program beyond 2014. The other thing that I'll be fighting for is with the $2 billion infrastructure fund that will be reintroduced once we become government again, and fight for a new hospital, for the new regional hospital for the Cowichan Valley, one that we desperately need, that will reduce the overcrowding there. The other thing that we've done is we've introduced a tax credit for caregivers who are caring for family members and loved ones at home. And and the other agreement that we came up with the provinces was to reduce the wait times in the hospitals.
Thank you.
Thank you.
Anne-Marie Benoit, please.
Well, the last thing I remember from our healthcare is that we're losing a lot of our healthcare system. People put in Tim Horton to wait patiently to be served. They shouldn't have to do that. The Green Party will set up a universal pharmacare program to buy prescription drug in bulk to cut down on costs. We will provide funding to train more doctors and nurses and ensure that every Canadian has access to a family doctor and team-based care. And we'll expand healthcare coverage to include alternative healthcare practitioner. Also, ensuring a universal access to high-quality, publicly administered healthcare. Invest in programs that prevent illness and promote wellness, like free membership to gym, people who need that on low income. Create a national strategy to increase mental health support. And where there's an overlap with the provincial jurisdiction, we call for action to be defined in collaboration with the provinces and implemented according to jurisdiction. We will provide,
Thank you.
Thank you.
Brian Fillmore.
Could you repeat the question, please?
Yes, it has gotten a little bit
Yeah.
lost. What is the federal government's role to ensure aging and crowded hospitals, like NRGH, remain viable for an increasing population?
Okay, thank you. That's an excellent question. Right back to my conservative friend here talking about the Conservatives spending money on healthcare. The Conservative government has spent no money beyond what the Health Accord has already promised by the Liberals back in 2004, and have made no promises to go beyond that. The Liberal Party has promised to continue the 6% escalator for healthcare, and will continue making sure that money gets to the provinces as it should. As far as the overcrowded hospitals, money has to be spent there. We need to continue working on that, and the Liberal government has done a great thing called family care as part of the plan. And under the family care, it's going to allow you to take care of your aging family member at home. You'll be able to collect EI for up to 6 months and stay home and take care of a loved one at home. That will save our health system millions of dollars, billions of dollars probably, and it will also be more compassionate. So that's where the Liberal Party stands on that. Thank you.
Thank you. We will start with John Corey this time. What investments need to be made now to meet the future needs of the South Island Transportation Network?
Well, of course, there's been a lot of talk about the E&N Railway, for example, but that's not the only transportation link that needs to be improved. And what I'm excited about is, before this election, the government put in its budget a $2 billion annual infrastructure fund to allow local governments to apply to in order to develop important infrastructure. Now, on the E&N Railway, I mean, I facilitated an in-person meeting with the Island Corridor Foundation Executive Director and the Minister of Transport. I wrote in support of the initiatives of the E&N Railway, and I'll be working hard as a Member of Parliament in government to ensure that we get the funds we need to restore that line. But road improvements are also important, and with that infrastructure fund, we will be able to meet the needs. These decisions often are made at the local level, and with the priorities of the local governments and communities and organizations, I'll be fighting hard as a voice in government to get those tax dollars from Ottawa back into this riding.
Thank you.